how critical is COVID-19 vaccination for university students, and which group of students are priority?
I remember Prof. Weber, before we started this meeting, talking about her medics and persons who are exposed as students, and I agree that they really need to be priority, those medical students and those in supporting frontline areas of their practice was critical. But I also believe that our teachers in training who interact with students in the classroom, they're also at high risk. And I think in the same vein that we are looking at teachers as the second string responsive workers, I do agree we couldn't compete with the nurses and doctors and frontline workers who are faced with that every day. But I think the second string of persons should be the person's education. If you look at a teacher interacting, they interact with an average of 40, 50 up to 100 students daily if they're going face to face. And if we should go back face to face, as you seem at the indication that we want to do as quickly as possible, then it means that teachers and student teachers should be a priority in our next stage.
Well, they're having the debate in the United States right now about, because they're trying to open up their schools, and they're saying that teachers need to be vaccinated. But as was mentioned before, there are nursing students, dental hygiene students, medical technology students, and medical students for, in the case of UWI. They all need to be vaccinated because they are interacting with the public. But many of our students also take public transport and therefore are exposed. And so they, you know, that need to be factored in too. But if we're going to open back up the schools, then vaccination has to be widespread to be able to manage that.
So at the UWI, we've already taken the position where all our students who are and staff who are in that clinical space, so it's the MBBS students, the nurses, the physiotherapists, they all have to treat everybody they're going to see as if they're potentially COVID positive. So we've been able to work with our partners, our alumni, to get PPEs for them. And I mean, that's a price right there that we haven't been able to put that a dollar value on. But if they could get vaccinated, that would be my first tier. But then as educators, that second tier, I think we also need to be sure that we can get vaccinations to all our teachers, all our lecturers, all our demonstrators, our tutors, persons who are going to interact with the students. Because that's how you will get to that herd immunity. You can get back people into the spaces that they want to be in, so we can move forward.
We have prepared a list of frontline persons who we have submitted the list to the Ministry of Health to have prioritized for vaccinations. And these are staff and students who relate in the clinical spaces. So we have our nursing students, we have dental students, dental hygienists, medical technologists, and others that have to interact in the clinical spaces. And of course, those who have to come in for physical face-to-face laboratory exercises as a part of their training, they will be next in line.